In a country that prides itself on providing some of the best specialist medical care in the world, it's easy to wonder why 28 million of its own people are without health insurance, why nearly 45,000 people die each year due to a lack of insurance coverage, and nothing is being done to save those uninsured individuals who are 40% more likely to die than those with private insurance. Health insurance in our country is a matter of life and death, and we are fully capable of bridging those vast differences in health disparities through a program of universal health care. The main issues that we see today within the U.S. healthcare system are excessive spending without better health outcomes, a large number of uninsured individuals, about 27.5 million to be exact, according to the U.S. Census Bureau, administrative inefficiencies, which are caused by private insurance companies, which complicate efforts to provide care, a lack of focus on preventive care, the fact that specialty physicians are grossly overpaid in comparison to primary care physicians, when primary care physicians are actually recognized as the most important doctors in terms of their influence on an individual's health outcomes, and the fact that doctors are rewarded for doing more, like overtreatment and excessive testing, instead of being rewarded for better patient health outcomes. My proposed solution is universal health care, which would be effective in addressing a lot of the issues that I just mentioned that we see in our current healthcare system. It would eliminate the concept of someone being unable to afford medical care, and this would thus increase life expectancy. So that higher risk, the 40% of people who are uninsured, who are more likely to die each year, would be completely eliminated. The use of emergency rooms as a means of primary care for people who are uninsured would greatly decrease, and thus medical expenses would greatly decrease. People would still have access to medical care even if they lost their jobs, which is really important because according to a documentary by Palferman, people who lose their jobs are at a significantly higher risk of getting sick. So universal healthcare coverage would be effective in negating those issues that we see. It would act as a means of preventive care by allowing everyone to have access to primary care doctors so that health issues that routinely occur can be addressed as quickly as possible and possibly even prevented. It would put more of an emphasis on the importance of primary care physicians who work with their patients to increase exercise, improve poor eating habits, and decrease poor behavioral issues, which are all effective methods in reducing the risk of chronic diseases that cost us trillions of dollars each year in medical expenses. It would also increase the availability for vaccinations and maternal health care, which, according to Dr. Galloway, a public health professional, are the two most important public health initiatives in terms of improving health outcomes. Pre- and postnatal care results in less birth complications and healthier babies, thus meaning that if pre- and postnatal care is available to every single mother, we will have healthier babies across the entire nation. So that would mean less people who are going to need to use the medical system throughout their lifetime. Infant mortality is also the determiner of entire population's health and well-being. So if infants are born healthier and mortality rates are lower, then overall health population greatly increases. There will always be people, however, who will continue to eat poorly, not exercise, and engage in poor behavioral habits like smoking and drinking excessively. But the ability for some of those people who have never had access to a primary care physician to then have access to a primary care physician who would be able to guide them to make healthier decisions will be what makes the difference in health outcomes. Universal health care would also eliminate a medical professional's ability to make more money by doing more procedures, ordering excessive testing, or over-medicating, because under a single-payer system, doctors would become government salaried employees, so primary care physicians would see a pay increase, while specialists would probably see a pay decrease. The inability for a doctor to get rich, essentially, would increase the quality of care. Decisions would be more health outcome based as opposed to monetarily based. It would also massively decrease spending as overtreatment, overmedication, and excessive testing would not be as commonplace. Universal health care coverage would also increase physician efficiency and quality of care while cutting costs. Private insurance companies make it really difficult for doctors to effectively provide quality patient care due to the fact that they have a long list of things that they will cover and will not cover, and it varies depending on the private insurance company that you're dealing with. So doctors are pretty much forced to kind of figure out what is going to be paid for and what is not going to be paid for. A lot of the times, these specifics is what forces physicians to make difficult decisions and often sacrifice the quality of care that they're giving to their patients. Some practices have reported that they spend an average of $83,000 a year on things like claims, coverage, and billing, while the average doctor spends about 9 hours each week on billing and administration, according to an article written by Dr. Carol Paris. So, universal healthcare coverage would completely eliminate all of these issues of cost and inefficiency. Medical offices also wouldn't have to waste money paying salaried employees whose sole jobs are to deal with insurance companies. So, the universal healthcare system would streamline billing and cut out the insurance middlemen. How would this plan be adopted? It would run through something similar to the way it does in Germany or Great Britain through a taxation system. It would be phased in so that it wouldn't cause such immense economic consequences. One way to go about the taxation is to do it like they do in Germany, where everyone who's part of the workforce pays a set specific percentage of their salary into the system so that people who have jobs and don't have jobs, everyone will be covered. Another way to do this is through the increase of income taxes. So, for example, people who make between $250,000 to $500,000 normally would pay an income tax of 35%, but then with this new universal healthcare coverage would pay an income tax of 40%. And that extra money would go towards funding the universal healthcare coverage plan. Universal healthcare is the most effective way to address the issues of poor health outcomes and a lack of equity and social justice in the current system. A nationwide basis of care will be established and an equitable system will be achieved through universal healthcare. With universal healthcare, our country would be making big steps to creating conditions in which all people are capable of becoming the healthiest version of themselves. It would also address, as I stated previously, a lot of the issues that we currently have in our system in order to create better health outcomes in the long run. Universal healthcare would be able to create equity by giving everyone access to the same system, the same doctors, the same quality of care, so that each person, no matter their socioeconomic status, their race, their education level, would have that opportunity to attain their highest level of health. In this way, it would bridge those gaps between the differences in health outcomes of race, socioeconomic status, and education. According to public health professor and professional Dr. Galloway, access to healthcare is considered one of the 4 major health influences. Universal healthcare would create a more equal opportunity to become a healthy and prosperous adult across all education and income levels. Currently, there's a cycle of poverty that exists where once you're in it, you can't get out. And with poverty comes overall worse health outcomes and a situation where affording health insurance and being able to go to the doctor when it's medically necessary is just simply not feasible. Because all medical practices would be more strictly forced to provide the same standard of care for all patients, you wouldn't see that huge socioeconomic gap where wealthier people are able to afford the best care, the most expensive doctor, the newest equipment. Because under universal healthcare coverage, everyone would have access to the same things. Socioeconomic status thus would see an overall reduction in how greatly it influences health outcome and life expectancy. Issues seen with disparities in health among different races could be addressed through universal healthcare as well. Maternal mortality for African American women is at an all-time high, as a Black woman is 3 to 4 times more likely to die during childbirth than a white woman. Proper care during and after birth through OBGYNs and primary care physicians would be more readily accessible to the vast majority of Black women who currently don't have the means to access this care with universal health care coverage. The life expectancy of Black males is also significantly lower than the life expectancy of white males, due partially to economic issues, health issues, and lifestyle habits. All of these issues and the aspects of each of these issues could be addressed through universal healthcare coverage, as it would be free to access medical care and thus would be able to reduce the health issues that we see that are more common in Black men, and also reduce the poor lifestyle and behavioral habits. As public health professor Sherry Glide of Columbia University states, the people who are most at risk are those who do not have health insurance at all. They're at risk of not getting regular care when they need it. They're at risk of not catching real problems before they get serious enough to not be treatable. They're at risk of not getting the best treatment when they actually do get sick, and they're at tremendous financial risk. They could lose everything that they saved in their lives because of some even fairly minor health problem. So universal health care is not only important in addressing the social determinants of health, but in limiting the previously detrimental aspects of them, while at the same time eliminating the daily risks that people who don't have insurance have to face. It's clear that in many ways that universal healthcare coverage would help to heal not only our hurting system, but the people of the United States as a whole. Not only does universal health care address the inefficiencies of the current system, but it also effectively addresses an even more serious issues. That currently in our society, low socioeconomic status and an inability to acquire health insurance is a death sentence. Without a serious movement towards access to medical care for all, people will continue to die at disproportionate rates, and both health equity and social justice will never be achieved.